Today we are fortunate to have Dr. Sales, who is a well-known and well-respected vascular surgeon. I'm aware of your very hectic schedule, and I want to thank you for taking time out of your busy day to come speak with us future medical students regarding your journey in the field of medicine. So I really appreciate it.
My pleasure.
Dr. Sales, he runs the Cardiovascular Care Group, which is the second largest vascular group in the country, right? Which is amazing. In addition to that, Dr. Sales is a board-certified vascular surgeon. His clinical expertise in the management of lower extremity vascular disease and the management of vein disorders. He's actively involved in clinical research, serving on many committees at the local, regional, and national levels. He has been voted by his peers a number of times for the Top Doctor Award featured in New York and magazine and New Jersey magazine. And I'm going to introduce Dr. Sales a little bit here, and then we'll get on to the questions. All right. So Dr. Sales graduated Magna Cum Laude from the State University of New York at Buffalo. He went on to get his medical degree from the Mount Sinai School of Medicine in New York. Also, you received your MBA from Rutgers University. A little bit more on that later. But also, interesting enough, Dr. Sales was a Harvard dental student for one point in his life, and I'm sure we all want to hear about that as well. So I could talk on and on and on about the many achievements Dr. Sales has throughout his career, but this whole video would be dedicated to that. But I want to move on to the questions and pick your brain a little bit about where it all started, where you got interested in medicine. So I personally have had the privilege of observing Dr. Sales' office hours, and through the Overlook Summer Internship Program, which he runs for many years now, which was a phenomenal experience, and I'm very glad you were able to put it together, especially throughout this year with all of COVID happening. It was truly a great experience. And all I could say is that Dr. Sales doesn't sit around for one moment. He's always running around from patient to patient, but at the same time he delivers excellent care to every single one of his patients. And he also keeps in mind the family that's always usually there with him, which is something that I took personally and I hope to one day recreate for my future patients. Okay, so let's start with the questions. I want to start at the beginning. So tell me about yourself growing up. What were you like? Were you always interested in the sciences? Were you a straight A student? What were you like?
No, I was interested in the sciences. I was definitely not a straight A student. I always liked to take apart things and hopefully try to put them back together. I was usually successful, not always. So I was definitely always interested in using my hands. My father, who was just graduated high school, was really not was very good at fixing things, and he had a great wood shop, and I always took pleasure in going down to the wood shop and working there. Excuse me.
As you can see, Dr. Sales is always busy with ringing.
So I was always interested in taking things apart and putting them back together. As far as scholastically, I did well scholastically. I was probably graduated from high school and probably around the 10th or 90th percentile, 85th percentile. But I wasn't, a superstar. I thought I was always well-rounded. I was a soccer player. Back in my youth, I played baseball. Always interested in sports. I carry that bias with me today. I think sports is a great metaphor for medicine. I think medicine, as you know when you work with us, is a team sport, and I think athletes do well in medicine. I really do. So then when I had, believe it or not, I had always wanted to be a dentist. And that came from a relationship I had with my dad's best friend, who was a dentist, and we used to pick him up on Saturday mornings to go to the park to play ball. And while he was changing in his office, he let me play in his dental chair. And they had a mouthwash there. He told me it was cherry soda. I thought it was pretty cool. I could drink all the cherry soda I want. I could play with the chair that went up and down. And that was perfect. I thought, what a great gig if you can get it.
That's all you need.
So that's what it was. And when I was in high school, my senior year of high school, I spent one semester in a dentist's office, shadowing. And then I went to Buffalo and decided I wanted to do dentistry, and I applied, got to Harvard Dental School. Harvard Dental School, the first 2 years, was only 25 students, mixed in with a medical student. students. So I took the core curriculum, and about halfway through my second year, my grandfather had a myocardial infarction and died. I witnessed it. I saw him in the ICU, and if I ever make the story of my life, when I walked into the ICU, all of a sudden the lights went on, and I decided at that moment I wanted to go to medical school. So I came back to Boston, and I told the dean that, listen, I really want to go to medical school, and he said, I get it. There's always one or two people a year who's going to switch. He says, and we'll support you 100%, but you have to drop out of dental school first. We won't send any of your transcripts. We won't write any letters for you until you drop out, because we don't want you here if you don't want to be here. We don't want this to be second choice. I thought that was fair. So I did that, and I applied, and I really, I had done 2 years of Harvard Medical School. I really didn't think I needed to repeat the 2 years, both from a time and from a monetary point of view. So Mount Sinai accepted me as a third-year medical student, and I went to Sinai. And when I went to Mount Sinai, I went there with the idea I was going to probably be a cardiologist. I loved the cardiac physiology. I really enjoyed that. And my first rotation in my third year was medicine. And I realized very quickly that medicine was just not for me. It just did not fit my personality. I was not the deeply analytical person where you could look at a piece of paper like that and say, is that a piece of paper? It could be a book. It's possible it's a newspaper. And let's rule out the fact that it's not a bottle of shampoo. But I just didn't fit. My personality was that I look at something, figure it out, fix it, and move on. And that was really my personality. So I really decided surgery was right for me. I liked that. I liked the whole idea of it. And I got involved with Dr. Luke Burrows, who was a transplant surgeon, doing transplant research in medical school. And I really liked that. I enjoyed transplant. And I went forward with the idea that I would go into transplant surgery. I did that. I applied for general surgery residencies, went to Montefiore in the Bronx, and during my first year on my vascular rotation, I came across a very enigmatic, charismatic mentor, Dr. Frank Veith, who really kind of showed me the way and just really enlightened me to vascular surgery, and I just loved it. And I think, like most people, I think probably the biggest determinant of what you do in your career are people you meet along the way, and how you relate to them and how you respect them. And Dr. Veith was really just a great mentor, someone who really showed me what vascular surgery was. I remember the first day of internship, he would start off the rotation, he would meet all the interns and say, you can do anything for 30 days, and I promise you I will prove that. And it was by far the hardest rotation of our internship, and you worked like a dog for 30 days. And when you got done with it, you knew you finished it. I mean, you knew you had a good workout. And so I finished my general surgery residency at Montefiore, stayed on with Dr. V to the 2-year fellowship, and then came out to New Jersey to get a job as a vascular surgeon in practice.
It's a very interesting story. So it shows a lot of the current pre-medical students that it's not a direct route to medical school. Everyone has their own path, and that's fine. And also, one thing that was interesting to me was the fact that you weren't a straight A student. A lot of it's currently propagated that it's very important to have straight A's in order to get into medical school. But that's not just it. There's more to it, to the field, than just getting perfect hundreds on every exam. So that's something that stood out to me most, and it's very relevant to current pre-medical students. I have a question regarding how you handled the stress and coursework throughout undergrad, because this is specifically targeted towards pre-medical students. Maybe some skills that you generated maybe in high school, college, that later you went on and took into medical school.
I think probably one of the most important things in the pre-med years is to develop relationships outside of the pre-med world. In undergrad, pre-med, at least in my days, and you can speak to whether it is now, was very cutthroat. There wasn't a lot of collaboration. There wasn't a lot of cooperation between combatants, if you will. You always looked at everyone as a potential threat. because they could get the spot that you wanted. So it wasn't purposeful. I don't think I went out and did it on purpose, but it just so happened that really very few of my social group was pre-med or pre-dental or something like that. They were more engineers, business, whatever they were. So it allowed me to truly break away from what I did. I also really made sure I kept time available to do the things I like to do. I went to school in Buffalo. I played all intramural sports, during my time. I had a personal thing that I would never study on Saturday nights, ever. I always made sure I went out on Saturday nights. Sunday was always a study day. Saturday was usually a study day. But Saturday nights I always kept for myself. And I always made sure that I kept my social group. I kept doing the things I liked to do, which was, in those days, primarily sports. I played sports and hung out, with my friends.
Got it. Okay, and also I'm interested to know about your MBA. Were you always interested in management? Because right now you're running such a well-respected and big, large practice. But were you always interested in management from the get-go or no?
No, I really wasn't. I think, I was always a leader rather than a follower ever since I was a kid. I never, not that I wanted to blaze a path. It was never my interest, but I naturally enjoyed leading. I didn't shy away from it. I'm not sure I looked for it, but I always wound up in the leadership roles in a lot of things that I did. When I came out here, it was a little bit different because I had joined a group that was an older group run by older people whose timeline was very different. And things at that point were changing in medicine. The 1990s, when managed care was coming through, things of that nature were really affecting the landscape. And the financial aspects of medicine were changing at the same time that we were going through the dot-com bubble. So, with all due respect, a lot of these people I went to college with who were barely scraping by with 2.0s and 2.5 averages were out there in the dot-com world making seven figures. Here I was struggling. I had two daughters who were young, who I knew wanted to go to college, and I was in a failing business. So my decision at that point was, I'm going to go and get my MBA, and I'm going to leave medicine, and I'm going to go to Wall Street. Well, I can do it. I'm as smart as these people are. And I enrolled at Rutgers in the executive MBA program, which was a great program. It really was a fantastic program. And I realized about 2 to 3 months into it that what I really liked to do was taking care of patients. That's what I really enjoyed. So my thought at that point changed. I said, you know what? I'm going to get my MBA, and I'm going to take over the group. I'm going to run the group, and I'm going to give it my best. If I can turn it around and make a go of it, I'll stay. If not, we'll see what happens at that point. And, like they say, the rest is history.
Very interesting. Yeah, that's amazing. And how much of that knowledge from Rutgers Business School did you put into this prior practice? Did you use a lot of those skills that professors taught you, or not really?
I get that question a lot. It's hard to say. That's a hard question to answer because you never know where you acquire the knowledge. There's no doubt that just as in medical school, when you start medical school, a lot of what you learn is the language of medicine. So a lot of what I learned is the language of business. And some of the critical thinking aspects of business I was taught, in my executive MBA program, without a doubt. The discourse with other students and colleagues who were learning at the same rate I was, but coming from different fields. So I think that was very instructive for me. I do think that Rutgers allowed me to take away a fund of knowledge that I didn't have beforehand, without a doubt.
Understand. Okay, and would you say that, would you recommend an MBA for many doctors? Do you think it made you a better doctor?
I don't know if it made me a better doctor. I think to the extent that I'm a real believer that in any education that you can get adds to who you are, and anything that makes you a better person probably makes you a better doctor. But I don't know if it made me a better vascular surgeon per se, other than the fact it probably made me a little bit of a broader person.
Understand. Okay. I think we'll wrap up here because you have a lot of patients to see today. And I really appreciate you taking the time to speaking with all of us. Just one more thing. What is one piece of advice you would have for current pre-medical students and future medical leaders?
I think 2 pieces. Learn the Krebs cycle, because you're going to need to know it in about 8 courses throughout your life. But you'll never need to know it once you get to practice medicine. But I think probably the most important thing I can tell people who are embarking on this journey, it's worth it. It's absolutely worth it. It's a hard road. It's a very hard road. It's probably harder than most of your friends in college are going through now. But I think that it's very easy to knock what you do. And people say, oh, being in medicine is horrible. HMOs, hospitals are taking over, corporations are moving in. And that's all true. But the idea of being able to give somebody back their health, have somebody trust their greatest possession with you, either the health or the health of a loved one, and getting to be a student for life, are 3 of the things that make medicine the best job in the world. And if I get to push the rewind button and replay, wouldn't do anything different. I would do the same thing I did then. I would do that now.
That's awesome. Okay, well, thank you very much, Dr. Sales. It was a pleasure having you here and speaking to future medical leaders with MedSpot, an organization that inspires and educates the next generation of medical students and medical leaders. So we really appreciate it, and we hope you have a great rest of the summer with COVID, and I hope everything runs well in your practice. Thank you very much.
Thanks, Sean. Thanks for the time.